All right, folks. Thanks for joining us here for our next talk. And just a reminder up front for those who just joined us, we do have the Expo down the hall where all of our speakers have a booth. Typically what happens at these is our Q&A session runs long afterwards. And if so, you can just find Dr. Kelson at his booth down the hallway. And again, if anyone's hungry, there is a food truck out front, Eats and Sweets. Our next topic here is snoring is a ticking time bomb. Save your life and marriage. This is presented by Dr. Andrew Kelson, who has been practicing dentistry in Longmont for 15 years and is the owner of Dental Horizons. Doctor?
Great. Well, thank you. I appreciate being here. I'm always curious if we're trying to save lives or save marriages. It's a bit of a hyperbole, but I do want to talk to you about the seriousness of snoring. And as you mentioned, I've been practicing for 15 years. And I'll be honest, when I got out of dental school, I learned about teeth. And I realized as I practiced more and more that there actually is a tongue and there's a skeleton in our mouth. And it also turns out that our mouth is very much connected to the rest of our body and our health. And so today I wanted to talk to you about, to some degree, how those are connected. And I wanted to start out, I have a video that I wanted to play. Our sound is not working very well. There we go.
Having an upper airway that lets oxygen flow freely into and out of the lungs is necessary for overall well-being. But if the upper breathing passages are narrow or blocked, it makes breathing more difficult. During sleep, a lack of the necessary oxygen puts a strain on the heart and brain and may cause complications. Your dental provider plays a crucial role in identifying airway problems. They are often the first health professional to identify airway dysfunction because of the signs that can be observed within the mouth. A person's airway may be restricted due to certain anatomic features, such as a small mouth or throat, overly large tonsils or adenoids, or an elongated uvula and soft palate. A blockage of the upper airway during sleep is often due to the relaxation of the tongue and soft palate moving to the back of the oral cavity. The potential signs of a restricted airway include tooth grinding, tooth wear, tooth decay, having crowded teeth, nasal issues, obesity, mouth breathing, and snoring. Often, treating a dental issue like grinding or tooth wear will simultaneously improve a patient's airway and sleep quality and lead to an improved quality of life. If left untreated, a constant strain placed on the heart and brain coupled with poor sleep quality, can result in insomnia, chronic fatigue syndrome, fibromyalgia, gastrointestinal issues, depression, anxiety, nighttime teeth grinding, and cardiovascular difficulties like high blood pressure and stroke. Given the potentially serious complications, it is critical to work closely with your doctor to screen for airway issues and develop a treatment plan that meets your unique needs.
All right, so that was a lot of information in a very short amount of time. Snoring is it's a sign that there's an airflow restriction. There's vibration in the soft tissue. And so when I say it's a time bomb, I may be a little over dramatic, but if you were standing up and walking throughout the day and when you were breathing, there was airflow and you were snoring during the day because of this restriction, you would know that something's going on. It happens at night because everything relaxes, and so that restriction occurs. And so this airflow restriction is going on at night for many, many hours. So we know that breathing is very critical to our health, to our overall health. This snoring is the sign of a airflow restriction. And this restricted oxygen then puts massive strain on our heart, on our brain, and really every other system in our body. So snoring is a silent disease. Well, there's really nothing silent about snoring. It's actually quite loud. But the underlying conditions, the underlying health issues that are going on if you're not getting good oxygen is silent. Because there aren't any immediate consequences. You could be snoring for years and years and years and be, quote unquote, fine. But many of the other health issues, many other health conditions that are connected to not breathing then begin to manifest themselves. So I want to kind of share some myths of snoring. So the first myth is snoring only affects those that are awake. So I hear this all the time. I ask patients, I look in their mouth and there are signs in the mouth of someone who might be snoring. I'll just ask, are you snoring? And they're like, oh, I don't know, ask my wife. As it only affects my sleep partner, it doesn't affect me. Well, that's a myth, because snoring does affect your health. And snoring is a serious health concern. Really, any form of labored breathing does affect our health. And so it not only affects our partner, but it affects us. So that's the first myth that I wanted to put to bed. I just came up with that. Put to bed. That's pretty good. Myth number 2. Snoring is an obesity problem. So snoring is an anatomical issue. And I think a lot of times sleep apnea and snoring has been pegged incorrectly as a quote-unquote fat man's disease. I've heard that. And that's absolutely incorrect. I have patients come in that are very young, fit athletes that have a narrow airway and have sleep apnea. It's absolutely an anatomical issue. Now, weight certainly is one variable that can affect our airway, but even very young, petite, old, it doesn't matter. It's an anatomical issue. I have, at our booth, I have a 3D printed version of an airway. And just with airflow, if you have a small tube, all you have to do is open up that tube just a little bit to exponentially improve airflow, or vice versa. If you have an air tube and you close it just a little bit, it exponentially decreases airflow. And so we don't have to do a lot to improve that airflow when one is sleeping. Okay? And then the third myth I want to debunk is that snoring is cute. Now, certainly babies are cute, but snoring in babies is not cute. Snoring is, again, an indicator that they're not getting good air. And then that affects the growth and the development of everything in the body. Look at this baby, mouth is open, so mouth breathing. Now it's really easy to see that here in this baby, but we as adults mouth breathe all the time as well. Oftentimes it's a function of our tongue. So I mentioned that, I learned about teeth, but I actually didn't know anything about it. There's a tongue in our mouth, and the tongue affects the way we breathe. The tongue affects the way we sleep. The tongue affects our bite. And in babies especially, if we can help improve the breathing, we now improve the growth and the development of that individual. We reduce the need for orthodontic intervention as they grow older, and improve the total health of the individual. So does it really matter how we breathe? If you look at this individual, he's taking big, deep breaths through his nose, right? It's oxygen. What about this individual? He's taking deep breaths as well. It's oxygen. Is there a difference? What about this individual? He's breathing. All of these, breathing is not breathing is not breathing. That's the point I want to make. And so how we breathe affects every system in our body. So the nervous system is divided up into two general systems. We have a parasympathetic and a sympathetic. And the sympathetic nervous system is that fight or flight. Parasympathetic is that rest and digest. And so when we're taking big, deep breaths through our nose, we're really activating that parasympathetic system. When we're running and fleeing, we're activating that sympathetic nervous system. So if we're breathing in a manner that is constantly activating a sympathetic nervous system, and we're doing that at night, we're not getting good air. That puts strain on our heart. That puts strain on our mind. We're not even really getting the rest that we need for the time in which we need to do that. Over time, we're upregulating the sympathetic nervous system and living in a state of constant sympathetic drive. And so breathing at night is just as important as breathing during the day. Okay? Well, how do we manage some of that? Well, there's a lot of different things we can do, but the first thing, I believe, is recognizing that we're snoring or that we have some form of labored breathing at night. And that's really hard because we're sleeping. So we don't know. We just may wake up tired, or there are certainly other chronic diseases that are associated with sleep apnea, but unless someone says, hey, I think you need a sleep test, sometimes we're going through our entire life with labored breathing and don't know it. Now, some of us have a spouse that nudges us or kicks us and says, you're snoring, get on your side, or, but not all of us have that. So one simple solution is a Snore Lab app. So there are apps on your phone that you can download, and it records you when you sleep. That's good for your spouse, too. When you say, you snore, and they say, no, I don't snore. What are you talking about? So you can download that app and just record them, and that then measures your snoring. Now, that's a very low-tech way to kind of get a preliminary awareness if you're snoring or if you have some form of labored breathing. So I guess the first step is diagnosis, right? Nasal strips. So nasal strips open up the nasal passages. Nasal breathing is really that's where it's at. The more we can nasal breathe, that's where better health begins. Nasal breathing will filter the air. It releases nitric oxide, which is a powerful chemical in our bodies. When nitric oxide is released, what that does is it opens up our veins. It's a vasodilator. And so what does that do to our blood pressure? Well, that's going to lower our blood pressure. And so if we can lower our blood pressure just through good nasal breathing, then our body's doing that. So nasal strips essentially open up those passages. That's one way at night to kind of have a better awareness. You can do that and you'll wake up in the morning going, wow, I just feel different. I feel better. Well, it's because you've been able to breathe through your nose instead of your mouth. Mouth taping. So this is kind of a new trend. A little bit of medical tape just on your mouth here. Clean out your nose really good before you go to bed. Maybe take a hot shower and just blow everything out so that when you do mouth tape, you can breathe through your nose. Oral, a CPAP. So that's kind of been... Absolutely. Do both of them. CPAP has kind of been the answer that the medical field has had for someone with a sleep disordered breathing or sleep apnea. And in many cases, that is still very appropriate. There are oral appliances that can also be used that essentially move the lower jaw forward, open up the airway, and increase that passage. Again, I mentioned you don't have to increase the radius of that airway very much for exponential results. My oral myofunctional therapy. So this is a relatively new field. Essentially is a tongue therapist. So we have therapists for everything, and there's a tongue therapist. When the tongue is not resting on the roof of the mouth, you might ask yourself right now, where's my tongue? Some of you will say it's resting on the bottom of my mouth. Others will say it's resting on the roof of my mouth. If the tongue can't get to the roof of the mouth, then you're going to encourage the mouth breathing. So a tongue therapist is going to essentially help you train your tongue where to go so that it increases nasal breathing. And so again, that's a fairly new field. And then laser treatment, that's another way to help tone the soft tissue and to help improve the airway space. Now there are others. How do we get better sleep? Well, I spoke with one patient today, or not a patient, but someone came up to the booth and talked about different medications, surgery. Those are other options to help. Oral appliance therapy are non-surgical approaches to helping us breathe and sleep better. This is an example of different oral appliances that we have available to us. So the top one it's a night guard. That's a fairly basic treatment, and that's going to protect the teeth. And I would say 99% of dentists are aware of a night guard and the benefits, the therapeutic benefits. It's mainly a preventative measure to help, again, protect the teeth. There may be some secondary benefit to your sleep, but that's not necessarily what it was designed for. A mandibular advancement appliance. Again, I would say maybe 80% of dentists are aware of this particular appliance. And essentially what that does is it moves the lower jaw forward and opens it up. So you'd wear that at night. This is what's called a DNA appliance, and it's also a mandibular, or mRNA. So DNA stands for day-night appliance, and mRNA stands for mandibular repositioning nighttime appliance. Kind of a cool play on words. But essentially, you're wearing this during the day and night to remodel the upper jaw, similar to orthodontics, but it's removable. And what that does is it expands the upper jaw. So the roof of your mouth is also the base of your nose. And if we can expand the roof of your mouth, now we've also expanded the base of your nose and improve that airflow. And so this is an appliance that you would wear, again, night and day to help move things. And then finally, these appliances here are more for children. So I mentioned if we can help expand and help the development of children to their full potential, then we can eliminate many of these challenges as adults in the first place. And that's exciting. And so you have a vast circle of influence. I talked about save your life or your marriage. I also want to encourage you as you have your grandchildren, knowing that we can do things to help them as well. So we are on the corner of Nelson and Airport Road in Longmont. Dental Horizons, I'm the owner of the practice, and again has been practicing for 15 years. Would love to open it up for questions. I don't know. Okay. So we'd love to open it up to questions. Yeah.
What is the best sleep position to prevent or help the situation?
Yeah, so when you're on your back, typically that's going to be when snoring is most prevalent. You can snore on your side. Typically when you're on your back, that's when your spouse is going to kick you and say, get on your side, because you're normally not going to be snoring as much on your side, but certainly you can snore on your side. Now, snoring again is a symptom of a bigger issue. And so we can control the snoring by laying on your side so that makes your spouse happy. But does it truly address the underlying root issue?
We're just looking for something that helps.
Yeah, sleeping on your side would improve the snoring, typically, not always. Yes?
Is the mandibular expander effective in older people?
Yes. So it has to be worn 14 to 16 hours. Your body is constantly regenerating. And we're going to be expanding the roof of your mouth. We're not going to get as much expansion on the lower jaw. But as the upper jaw begins to expand, that's going to naturally allow the lower jaw to move forward and then open things up.
I asked you earlier about dry mouth, and you said that it's kind of the same etiology as snoring, because you get dry mouth by breathing through your mouth excessively. How does biotin work to reduce that? And is the treatment beyond biotin the same as for snoring?
Yeah, so biotin is a medication. It's a lubricant that will decrease the symptoms of dry mouth. If you have dry mouth when you're waking up, typically that's a sign that you're breathing through your mouth. If you're breathing through your nose the entire time, then you're not going to have that dry mouth. I'm not sure if I answered. I know I didn't answer the complete question.
I'm trying to get the difference between the etiology of snoring and dry mouth. So you would think that if you have dry mouth, you'd also have snoring.
Potentially, most likely, yes. And again, without some form of diagnostic recording or sleep test, it would be difficult to confirm that. But my experience has shown that those who are snoring are also have dry mouth. Okay? Yes?
How does having TMJ affect the treatment options?
Great question. So, TMJ, if you have an underdeveloped maxilla, upper jaw, that's going to push your lower jaw backward because they want to align. And when you're pushing your lower jaw backward into that condyle, the joint, that's going to create a lot of pressure on the joint. A lot of patients with TMJ issues or TMJ pain, it's misdiagnosed as just a TMJ issue, when in fact it's a breathing issue. If we can help the upper jaw move forward, then give space for the lower jaw to move forward, we eliminate the TMJ pain.
What do the letters TMJ mean?
Thank you. Temporomandibular joint. So TMJ is temporomandibular joint. And I don't think I answered the question still. Can you ask it one more time?
Well, like for instance, that one appliance where you move your lower jaw forward.
Oh, yes. So that has traditionally, again, been the dentist's answer to sleep conditions. This appliance is a relatively new appliance that is addressing the root issue, which is the upper jaw. This appliance here, the mandibular advancement appliance, actually one of the secondary contraindications or problems with this particular appliance is it can create TMJ issues. And so we have to monitor that very closely. With this appliance, where we're addressing the upper jaw, we're allowing the lower jaw to naturally move forward. Other questions? Yes?
If you're sitting on your side and you're not snoring, but you still have obstruction of breathing going on?
The question was, if you sleep on your side, could you still have some form of obstruction? Yes. And it may be to a point where it's not creating that snoring because the soft tissue is in a different location, but the tube is still small. Okay? There's another question here.
How long do you have to wear that?
This is anywhere from 18 to 24 months. Now, every patient is a little bit different, and anywhere from 14 to 16 hours a day. That's what we're really trying to encourage. So you put it in at night, and then you wear it in the morning, and then go to work, come back, put it back in the evening. And the longer you wear it, the shorter amount of time it's going to take. And this only works if you wear it.
Okay, I've noticed
Yeah.
I have a granddaughter that has a lowered, her jaw comes out already. over
Okay.
her upper teeth.
Yep.
Does she need one of those appliances probably?
Yeah, so traditionally, that lower jaw, if it's larger than the upper jaw, traditionally that's been treated by taking out teeth. And that is absolutely the wrong thing to do. And so the issue is not a lower jaw is too big, the issue is the upper jaw is too small. And so these type of appliances absolutely can help with that. You and then you.
Does it affect your speaking? To have that-
Yes, when it's in, you're not going to be doing any sort of speaking engagements. Yeah.
We're running out of
Yeah. Okay. So love these questions. Thank you so much for coming. We do have a booth down there and would love to entertain any individual questions.
All right, thank you very much. Yeah, and I saw a lot of hands going up there, so for any additional questions, the doctor will be at his booth just down the hall, and happy to answer any more questions, I assume. Yeah, thank you very much. Nice talk.